Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Contemplate. This audio podcast is part of Labostix and Blizzard and the specials. This audio podcast is part of an Echo and Update, and this audio podcast is part of a Storm Labostix production. In this audio podcast, looking at the conclusions, some of the conclusions in around this works. From science student M Bohtha at an academic institution in the United Kingdom or UK, and looking at the diagnosis methodologies utilized to determine SARS-CoV-2 or COVID-19. So in around this is where and around this it is where the where Bohtha had informed that patient X was diagnosed with SARS-CoV-2 after having some common symptomologies, and after having some challenges in around oxygen saturation and bronchial infection. Patient X was admitted into a hospital and then treated. The PCR polymerase chain reaction investigation was done a week post or after patient X was discharged from the hospital, and this showed a low viral quantity of viral load. And patients started their normal routine, aspects of their normal routine, and at the same time had thought that they had fully recovered. But at the same time, the patient X had still felt malaise or felt fatigue, and had also had some other symptomologies, and after even after a few weeks post being discharged from the hospital environment. Patient X was then referred to a SARS-CoV-2 or COVID-19 study cohort, and the case had shown that SARS-CoV-2 can be a long-standing sort of a challenge, and with time can also develop, and with time it is where some patients can develop symptomologies excuse me, some symptomologies such as pulmonary fibrosis additionally. So that draws this audio podcast to a close. This audio podcast is part of the Contemplate. This audio podcast is part of a Labostix, Blizzard, and the specials. This audio podcast is part of an Echo and Update, and this audio podcast as part of a Storm Labostix production.